Live from KTVN Reno, you're watching 2 News at 5.
Yesterday, board members gave the green light for a lease between the state of Nevada and the Human Services Agency, of course, through Washoe County, to dedicate a dozen buildings to the homeless population. I'm Kristen Remington.
I'm Landon Miller. The state owned the buildings at the Northern Nevada Adult Mental Health Services campus. They're set to be leased for about 10 years, both for housing and supportive services. Elizabeth Olvera went on a tour of that campus today and joins us live now. And Liz, let's start when the first people will be able to move in.
Well, Landon, not quite yet, but the goal is sometime early next year. Now, once the renovations here are finished, they hope to serve about 225 people at this campus. This is the entryway to the kitchen of the future postpartum building for homeless women with newborns. It's part of a regional effort to alleviate overcrowding in local homeless shelters.
We're going to relocate the family, the children, the women and postpartum from Record Street, which will free up additional space to add additional men that are currently in the overflow shelter. 212 beds will be opened up.
The 12 buildings on the campus are state-owned. Several have been vacant for a decade. The county has been working on the contract with the city of Reno, city of Sparks, and the state since April.
We've always known that they existed. We just needed to come up with a proposal that made sense.
The state will lease the buildings to the county for free to not only provide a warm bed and meals to the homeless, but also wraparound support like mental health and substance abuse services, among others.
Alzheimer's and dementia program for senior services. There is a Crossroads expansion for women.
Officials say the outpatient services and psychiatric hospital on campus will help address the root causes of homelessness.
I think we have to more and more treat behavioral health as a health condition. You wouldn't have a diabetic who was homeless go without care.
Especially since Whitley says such resources are already spread thin at the existing shelters.
Majority are eligible or enrolled in Medicaid, but when looking at the services they're receiving, they're not all receiving services.
Officials hope this is something that will not only keep our homeless neighbors off of the streets, but also impact our state as a whole.
It presents an intervention point for us at the state in terms of an investment in health.
Now, there will also be case managers on site, mobile pantries, and independent living at this campus. But before they can go forward, the contract does have to be approved by the State Board of Examiners at a meeting next month. Covering the big story live, Elizabeth Olvera, 2 News.
Liz.